Morning, doctors. My name is Angel of Philcare Pharma, a Filipino-owned company that is specialized in anesthesia, anti-infectives, and critical care products. I am here today to introduce to you our first line of defense for hypertensive emergencies in acute coronary syndrome and congestive heart failure, our IV nitroglycerin, nitrosan 10 mg per 10 ml. It is a clear and colorless isotonic sterile solution for intravenous infusion. It is available in 10 ampoules containing 10 mg of glyceryl trinitrate or nitroglycerin. Hypertensive emergencies are common cases dealt by our medical practitioner in the hospital. Distinctly in critical areas, it encompasses a spectrum for clinical presentation, which uncontrolled BP that may lead to impending end organ damage or dysfunction. According to Christy Hopkins, MD, MPH, Medical Director, Division of Emergency Medicine, Uni Healthcare, and a member of American College of Emergency Physicians, the most common clinical presentation for hypertensive emergencies are cerebral infarction with 24.5%, pulmonary edema with 22.5%, hypertensive encephalopathy with 16.3%, and congestive heart failure with 12%, and other clinical presentation associated with hypertensive emergencies include intracranial hemorrhage, aortic dissection, eclampsia, as well as myocardial infarction, retinal and renal involvement. So therefore, doctor, having this condition, the BP should be lower aggressively over minutes to hours. So the solution you need, doctor, our nitrosan IV nitroglycerin 10 mg per 10 ml. Nitrosan reduce the tone of vascular smooth muscles with marked effect on the venous capacitance vessel. Nitrosan reduce the venous return of the heart within lower feeling pressure, thus lowering feeling pressure, reduce the left ventricular diastolic preload with a result of myocardial oxygen consumption. Nitrosan reduce the systemic vascular resistance, pulmonary vascular, arterial pressure, thus reduction of afterload. Doctor, our nitrosan is the ideal drugs for hypertensive emergency, acute pulmonary edema, congestive heart failure, and myocardial infarction. Doctor, our nitrosan is the ideal partner for hypertensive emergencies like rapid onset of action for only 1 to 3 minutes, predictable dose. When you administer, especially with a higher dose, you will expect an immediate response with the medication. Easily titratable, less hypotension and hyperperfusion, rapidly reversible, short half-life for only 2 to 3 minutes, stroke volume and cardiac output, and of course, doctor, our nitrosan is affordable for only 490 compared to ISDN and IV nicardipine. Doctor, in clinical presentation of patients with chronic heart failure and myocardial ischemia, our nitrosan is a superior choice compared to IV nicardipine. As you can see, doctor, our nitrosan has a rapid onset of action, preload reduction, afterload reduction, does not contain coronary steal, coronary perfusion, less tachycardia, less hypotension, his administration, and of course, affordability. Doctor, the contraindication of nicardipine has a negative inotropic effect which can further worsen the cardiac function in patients with heart failure and pulmonary edema. Nicardipine is indicated unstable angina and immediately following myocardial infarction. Nicardipine also has a potent BP reduction mechanism result in a reflex tachycardia, which can further precipitate an MI patient. Doctor have also an evidence from 2009 ANSTAT that our nitrosan is the frontline treatment for hypertensive emergency. As you can see, doctor, our nitrosan is the initial drug choice for hypertensive emergency. And in figure 2, doctor, our nitrosan is the initial drug choice alone in plus combination. And our nitrosan also is used 2 times compared to IV nicardipine. And doctor, we have also a study from Eurostat for European Society of Hypertension update. The specific hypertension emergency, the preferred therapy for acute hypertension in ACS is nitrosan plus beta blocker. For acute hypertension in left ventricle failure, the preferred therapy is IV nitroglycerin plus diuretic agent. For acute hypertension in aortic dissection, the preferred therapy is IV nitroglycerin plus beta blocker. For acute post-operative hypertension, the preferred therapy is labetalol, nitroglycerin, and phenidopam. So, doctor, our nitrosan is the first choice for management for hypertensive emergency with coronary artery disease as well as pulmonary edema and heart failure. Doctor, we have also guidelines for American Heart Association and American College of Cardiology. The patient with STEMI and non-STEMI ACS, the recommendation for early hospital care, nitrosan is indicated for patient with non-ST elevation, acute coronary syndrome, non-ST ACS, for the treatment of persistent ischemia, heart failure, or hypertension. The class of recommendation and level of evidence is 1B. And for IV nitroglycerin is indicated for relief of ongoing ischemic discomfort and controlled hypertension or management of pulmonary congestion. The class of recommendation and level of evidence is 1C. Doctor, lastly, nitrosan is indicated in the first 48 hours after STEMI for treatment of persistent ischemia for coronary heart failure and hypertension. The class of recommendation and level of evidence is 1B. Doctor, our nitrosan is also Doctor, our nitrosan is also evaluated by BioSA at CEDRES, FDA approved manufactured by SRS Pharmaceutical and PNDF approved. Doctor, for posology, for adult, the initial dose is 10 microgram or 200 microgram. Sometimes they need as much as 400 microgram may be needed. For myocardial infarction is 15 to 20 microgram or 10 to 15 microgram per minute until the required effect is obtained. For unresponsive CHF, the starting dose is 20 to 25 microgram per minute. For angina, the initial dose is 10 microgram per minute. And for elderly, no evidence of posology. And for pediatric patient, no evidence has established yet. Doctor, I will also discuss the guidelines for dilution of nitrosan. As you can see, doctor, if the concentration you want is 100 mg and the dilution available is 100 ml, you will withdraw a 10 ml of a diluent and then you will add 1 ampule of nitrosan. And the concentration is 100 mg. And for the 200 microgram concentration and 250 diluent, you will remove a 50 ml of diluent and then you will add 50 ml of nitrosan or 5 ampules of nitrosan. Doctor, our nitrosan is available in Mercury drugstore near you. I hope you consider our nitrosan as the first line agent for hypertensive emergencies and acute coronary syndrome. Thank you.